861-7484.
Ocala's information station, 1370 WOCA.
Ocala.
Seven minutes after 11 o'clock. Thank you for tuning in. It's been probably 6 or 7 years since my father passed away, and the last half year of his life, he was bedridden, and he had been a very active person all of his life. But that last half a year, especially the part that he spent at home, he wanted to die at home. And he was in bed, and he had bed sores, and I remember well, and all these years later, I can still smell the medication, the ointment that the doctors prescribed for us to apply to the wounds. They used to be called bed sores, I think, and now they're called pressure wounds, or maybe both words or expressions are interchangeable. Dr. Bardia Anvar is on the phone. He is a wound care specialist, and we could have used him in those years. He's the medical director of skilled wound care, and he's going to tell you how to avoid pressure wounds in the first place and some practical tips for treating pressure wounds, also known as bed sores. Good morning, Dr. Anvar. Good morning, sir.
Good morning. How are you?
Pretty good. Where are you? Where are you calling from?
Our corporate office is based in Los Angeles, California. However, we are a national group of physicians where we provide wound care to patients in nursing facilities.
Oh, my goodness. And I'm guessing in a nursing facility, you probably have your share of that. How long does it take for a bed sore to actually develop?
Bed sores can happen very quickly. They can happen in a few hours. It depends on the health of the patient. So if a patient is not getting enough nutrition, not eating enough, has been in the hospital for a long time, as their health has deteriorated, they can get them very quickly. Obviously, healthier individuals won't get a bed sore or a pressure ulcer just in a few hours. It takes more. So we commonly see it in patients that have other disease processes going on in their bodies, and then they start to develop these pressure ulcers as well.
And is it because the disease is somehow making them more fragile to the pressure, or is it because they're simply lying in one place without moving?
Well, some patients, they've even done studies where they've turned the patients in the intensive care units, and they've still developed them. But if the patients are turned every 2 hours, they have to be turned the right way. But in addition to that, the skin has to be kept very clean, moisturized properly so it doesn't dry out. The patient needs to receive enough nutrition to keep their protein and blood levels up. You can prevent them. The most important thing, obviously, is because they're called pressure ulcers, the pressure needs to be removed. Unfortunately, a lot of people think pressure ulcers are because nurses didn't turn the patient or something. It's a result of bad care and medical care. Usually patients who have pressure ulcers have 3 or 4 other diseases, so it's not just the fact that something there was poor care somewhere along the line of the health care of the patient.
And this can also affect people that are ambulatory as well, not just bedridden.
Yes, it's true. And as you know, we have about 300 million people in America, and, we have a population of patients, around 6 million, who have diabetes. And then of those patients, 25% of them will develop a wound. So, and a lot of those patients are walking around. They develop the wounds in their feet. We don't call them pressure ulcers.
Oh,
we
really?
call them diabetic wounds. Yeah. And of those patients who have diabetes, 25% of them will develop a wound, and within 5 years, another 25% of them may end up with an amputation of that leg if the wounds get infected. So even patients who are walking around, especially diabetic patients, they need to be very, very careful about developing these wounds because they can become very, very bad and infected and deteriorate pretty quickly.
So when we self-medicate, do we do ourselves more harm than good? Let's say if I saw a wound under my foot, I might say, oh my gosh, I got to put some Desitin. I'm just coming up with a name off the top of my head.
Yeah.
Or Neosporin or something like that. Would I be doing more harm than good?
No, actually. Well, most of the problems are people don't discover the wounds until it's too late. So usually when people discover them, they can prevent them from becoming too infected. So the real work in treating wounds is actually getting the insult or whatever's causing them away. So putting bacitracin or putting Neosporin, which is a triple antibiotic ointment, is actually okay. But at some point you want to see your doctor, and you want to try to see a specialist in wound care. Most physicians actually only get in medical school 1 or 2 hours of training in wound care. So, and they don't get it during their training because it's not really something that's looked upon. However, there's about 6 million chronic wounds in America right now. And it's a very huge epidemic. We're spending $50 million a year treating these wounds a year in America. So it's very important that people do learn about this and that they do seek out a specialist and to really take care of these patients.
I know a few people who are older than us, and they are on blood thinners. And every once in a while, I'll notice new bruises on their arms because they'll be walking and they'll just bang up against a wall, or they're working on a car and they move their arm and they bang up, and then all of a sudden this huge bruise forms because of the blood thinner. Are they prone to having these wounds not just bruise but also open up?
Yes, those bruises, it depends on how much blood develops underneath the bruise. So if they get a huge pocket of blood underneath there, which we call a hematoma, those hematomas could become infected, so usually it depends on how bad the bruise is. If it isn't a ball of blood underneath, which is usually called a hematoma, it's a small bruise, those should usually heal and nothing will happen. But if they do swell up, you do want to use warm compresses to kind of break up the hardened blood underneath and try to get it to go away. Sometimes we even have to open them up and evacuate or take out all of the dead blood underneath.
Wow. Oh, wow.
Yeah, and then you're left with a hole there or, open skin there, and that's not fun, and it takes a while to heal those. So you have to be careful if you are on Coumadin. The biggest risk with Coumadin, obviously, is patients fall, and if they have head trauma, if they're bang their head somewhere pretty hard, they could have a bleed in their head.
Oh.
That's the number one way that patients who are on blood thinners can unfortunately get, they can die from them. So you have to be very, very careful.
Wow.
So, yeah.
My brother fell. I'll tell you real quickly my brother's story. He's 64?
Yeah.
I think he's 64 years old. He fell in the parking lot at Walmart, did not know he hit his head, or at least didn't think he did, and went by ambulance to the hospital. They checked him out and everything was fine. And then, let's see, maybe 2 months later, his family was reporting that he was slurring his words. He wasn't the same person. His leg was hurting him terribly. Long story short, he had a brain bleed. But they didn't diagnose it when he went into the hospital for the fall in the first place. So he had been living. He's okay now. They had to literally drill into his head and drain it out. And I guess he's making a good comeback now. So you say that's kind of the same thing.
Yes, that's pretty interesting. It sounds like your brother may have had an epidural hematoma that bled very, very slowly, because that is the case with epidurals. Patients fall and or they'll have some kind of head injury, but they won't lose consciousness. They'll still be awake. And within 8 hours, though, usually usually you'll see symptoms within within 24 hours with any kind of brain injury where something starts not looking right. So it's pretty unusual that he was okay for a month or two.
Wow. And he was on blood thinners too, right?
Yes.
Yeah, he had blood thinners, yeah.
Oh, okay. So he may have had a very slow bleed. Usually that could be seen on a CT scan. So when you go to the hospital, they'll do a CT scan of the head. Then there's the other kind of bleed, which is a subdural a bleed or a subdural hematoma that actually is a little bit faster. And those are actually harder to manage, and those could be worse off for patients. Epidurals, because they're outside of the brain, they're on the surrounding, they're outside of the actual protective coat of the brain. Once they're evacuated and the blood is taken out, it's kind of similar, to a hematoma you could even have on your arm. The patients are fine afterwards. However, once it's inside of the brain and there is a bleed, it's much, much harder to handle, and it could be a difficult recovery.
Dr. Bardia Anvar is our guest. We'll take a little break and be right back with Dr. Anvar. By the way, if you have a question, call in right now. You'll be on hold for about 2 minutes. The number is 622-9622. We'll take a break and continue our conversation. And we're focusing on wound care. Dr. Anvar is a wound care specialist. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, partly sunny skies. There'll be a thunderstorm in spots mainly this afternoon, the high 91 to 95. Partly cloudy tonight, low 70 to 74. Tomorrow, partly sunny with a thunderstorm around in the afternoon, high 91 to 95. And for Sunday, partly sunny with an afternoon thunderstorm likely, the high 92 to 96. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
La Famiglia Pizzeria has moved into Ocala. Stop by today at 2504 Southeast 17th Street and see for yourself what everyone is talking about.
Awesome place. I never get pizza anywhere else.
Great New York-style pizza and dishes.
Best pizza in Ocala.
One trip and you'll agree, La Famiglia Pizzeria is the best. La Famiglia Pizzeria. Stop by for a pizza that you'll love or call in and order yours for pickup. 352-245-2419. La Famiglia Pizzeria.
Good credits, bad credits. It's none of our business because we're not an auto dealer. We're not a bank. We're not your mother. We're OcalaForSale.com. Marion County's marketplace for cars, trucks, and SUVs. We've got thousands of sellers standing by to take your call. No middleman. But hurry, don't walk, don't run. Just sit down and log on to OcalaForSale.com. Prices and inventory change daily. Offer does not include dealer upcharge. Undercutting, rust-proofing, factory surcharge, or delivery fee. See website for details.
All right, 19 minutes after 11 o'clock. I don't know exactly what it's like to be a doctor because I'm not one, but just going back to the experience I had with my dad, I remember this. The family members would come in and ask the doctor the exact same question that I asked or somebody else asked. So they must get the same questions over and over. They have to be doctors. Are not only doctors, they're teachers. Yeah. Everybody who has something going on with them always is picking the brain of the doctor. And so I'm guessing Dr. Bardia Anvar is the same. He probably gets people asking the same questions that we're asking him right now over and over again. But don't let that stop you. If you have a need for a question to be answered, especially about wound care, call in now, 622-9622. Dr. Anvar, I heard you during the break say something about nursing homes in general. And you know what you said earlier, that makes me feel good, actually, is that sometimes it's not incompetence that causes a bed sore. And I think sometimes those of us who are not in the medical field think it is. You see a bed sore and you automatically think, oh my gosh, somebody didn't do her job.
Mm-hmm.
Yes, and I think there is a little bit of a negative impression that people have when they send their family members to a nursing home. Just to be blunt, I think a lot of people look at it as a place they go or they send someone to die, but that's not really the truth about being inside of a nursing facility. Most nursing facilities are designed really to rehabilitate patients and get them to go home, and that's really why they're called skilled nursing facilities. There's a term skilled in there. So on staff, there are physical therapists. On staff, there are obviously physicians, medical directors in the facility. There's directors of nursing, and there's nurses there rehabilitating patients to get them out. Unfortunately, there are some patients who don't have anywhere to go after the nursing facility, so they stay in the nursing facility, and then they become residents, and it's called the convalescent stay. But, when we decide that somebody needs to go there or we have to go into the nursing facility, I think people can get very scared about it. It could be a scary place. However, it should not be viewed as such. It's called a nursing facility because it's mostly nurses there taking care of you, whereas in the hospital you have physicians rounding, and you may have multiple physicians seeing you. In the nursing facility, you're mostly having the nurses come and see you. And the key difference in the nursing facility is you get your medications from a nurse, you get your vital signs checked, you get your blood pressure, your heart rate checked every few hours. Whereas if you go home straight from the hospital, you can't do many of these things.
That's true. Yeah, yeah.
Yeah, you can't have a physical therapist coming home every day. And as our health deteriorates, some patient population needs to go there. And you may develop the wounds there or at the hospital before you go there as well. And what our service does is we go to the patient and see them at the facility to take care of the wounds.
So why does a diabetic person develop a sore on the bottom of his foot anyway? What's going on that a non-diabetic wouldn't have that same thing happen?
That's a very good question. There's actually a number of different reasons. Number one, overall diabetes affects many of the different organ systems of the body. So your eyes, your vision becomes poor. You have diabetic retinopathy, so they can't see their feet very, very well. Number two is that their sensation goes down. They have a nervous system problem where it's called neuropathy, so they don't feel their feet. So when a diabetic patient bangs their foot against the wall or hits their toe in their shoe, most of us would feel it. We would take a look at it. They don't see that. And then once the wounds develop, because they have high blood sugars, their immune system is suppressed or is not as strong as it would be, and their ability to fight infection is not as good. So usually their wounds become infected. So it's all of these factors combined, and they also get deformities of their foot. They're called Charcot's deformity or Charcot's joints. So their feet don't function as properly either. So they have to wear special shoes, and usually we have to really examine the feet every week, make sure the toenails are cut properly, moisturize the feet properly so they're not very, very dry and breaking down either.
Oh, wow. And just real quickly, I know, and they're not a sponsor right now, but we've had a sponsor that sold diabetic shoes, and he would always say that Medicare pays it, right? Medicare,
yes.
Medicaid, something like
Medicare.
that. Yeah, one of them, yeah.
Medicare.
Yes, Medicare will cover that for diabetic patients, especially if they're at all at risk for developing any of these kinds of wounds.
You talk about hydration, staying hydrated in your wound care practice, and using moisturizers, because it just seems that if you have wounds, that for some reason the skin starts drying out.
Yes, so most patients, what we think about is, of course, that they need to eat. So sometimes we'll even put a feeding tube in the patient's stomach and make sure they're getting enough nutrition. One of the things that we may forget about, even when you have a family member at home that you're taking care of them, are they getting enough, water or hydration? So the key thing is that we can measure how much hydration we have is by how much urine the patient produces every day. Sometimes when they're at home or in the nursing facility, we may not be following how much they're producing. So they may have very low urine output, and that means they're dehydrated and they need more water. So that's usually actually the way we measure it. I know there's a lot of different formulas out there. You need to drink 2 liters of water a day, 1 liter. Certainly if you have something like diabetes or other diseases, it's not a good idea to drink soda. It has a lot of phosphorus. It has a lot of different compounds in it that are not good, sugars. So really you want to actually just have water, have patients taking water. And then moisturizing is very, very important in basically keeping the moisture in the skin. So from the lowest level is basically your Vaseline-based, just by getting Vaseline, petroleum jelly, and putting it on your body, to getting actual hydrating moisturizers that actually take water from the surrounding air and actually suck it into the skin, and those are the stronger ones. And sometimes when patients really have a lot of dry skin, maybe they have heart disease or low blood flow to their legs, their legs become very, very dry, you actually have to get hydrating moisturizers that will bring the water into the skin to keep it nice and moisturized.
Oh, wow. And is there a soap that can do this for us, or something? Is there a name we look for? How do we know what to get?
The Vaseline-based ones are things like Eucerin, Aquaphor. Those are the lower level ones.
Okay.
The highest level ones are, and then you have your lanolin-based products that are that you see over the counter that are the most common hand lotions. They have lanolin in them.
Okay.
The medical strength one is something like Moisturel, and then at the highest level are the ones that have alpha hydroxy acids in them or lactic acid in them, such as amlactin cream, which is very, very strong, and that can be bought over the counter too. So these need to be used in concert. Usually you actually need to have a specialist. Like if you have really severe dry skin, you actually should go to a doctor so they could give you a regimen of what to use.
Oh, wow. Good
But
info.
overall, go ahead.
Well, what is the, okay, when you get Desitin or a Desitin type product, it says something about is there oxygen in it or something? Somebody told me that for a wound, if you expose it to oxygen, it would get well, and you need a product that has oxygen in it. Is that right?
Well, there's really no dressing that you put over a wound and it brings oxygen unless you actually go to a hyperbaric chamber and you put 100% oxygen, but you're exposing, you actually go inside of a chamber. Desitin is more of an agent that keeps the area, keeps the moisture in. So it's usually used a lot of times with diaper rash. We even use it in babies. We use it in children who get diaper rash, and then we use it in elderly adults to kind of keep, and it also keeps away if the patient's having, a lot of urine or stool hitting the area and making it worse from getting worse. But the key is, if you don't have wounds, is to, when you come out of the shower, not to take very long showers for elderly patients, not very hot showers. Limit them to 3 to 5 minutes. There is really no soap, but you do want to clean your area at least 3 times a week. And then once you're out of the shower, is to apply the moisturizer while the skin is still damp. So not to wait until your skin is totally dry before you apply your moisturizer.
Before we run out of time, and we are very close, Doctor, I went to your website, skilledwoundcare.com, and you have an event happening next month, August 20th, in Orange County. That would be in California, obviously, right?
Yes.
Yeah. Okay.
Not the Orange in Florida, but we are educating close to 300 to 500 nurses at that event. In California for a day, and then we are going to be having these events throughout the United States, educating nurses about wound care.
Doctor, thank you for sharing your expertise with us. Go to skilledwoundcare.com to learn more. Dr. Bardia Anvar, thank you. We'll be right back.
Fox News Radio, I'm Lillian Wu. The Confederate flag no longer flies at the South Carolina State House. Thousands gathering to watch it lowered a short while ago by an honor guard of South Carolina troopers. The debate